Hi, my name is Nicole Mercado, and I'm going to be talking about athletic training. Who are athletic trainers? Athletic trainers are health professionals that collaborate with physicians to provide medical services like injury and illness prevention, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation, mostly for sports teams. They can work in many different areas, but the majority of the times you see athletic trainers working with colleges, high schools, or professional sports teams. It's not the same as personal trainer. A lot of people get confused with the profession and refer to athletic trainers as just trainers, and that's why it gets pretty confused. Personal trainers are non-medical professionals who help develop individual fitness and mostly work in gyms or have their own companies. Um, yes, personal trainers can be educated in some medical services, but they're not required to have certifications, unlike athletic trainers. To be an athletic trainer, you have to graduate from a master's program and you have to have your license. Daily duties for an athletic trainer consists in conducting assessment on athletes, care for athletic injuries using physical therapy, equipment, techniques, and medication, evaluate readiness to play, and provide clearance for participation if somebody got a concussion. They're in charge of clearing the athlete, apply protective or injury preventing devices such as tape, bandages, or braces to different parts of the body, ankles, wrists, you name it, shoulders. And usually the tape, it can be for practices or for games, or both. And they also collaborate, like I mentioned before, with physicians to develop and implement rehabilitation programs for injuries. On a game or in a practice, usually the athletic trainer, the physicians are not there most of the time. It's the athletic trainer who is there as a first responder. Wherein there's an injury in practice, the athletic trainer assesses it, and then the physician oversees it, and together they create a treatment plan. Athletic trainers also travel with teams to sporting events, and they are present at their practices. And there's many other things that an athletic trainer does too. They handle paperwork, um, they handle medicine. They in the clinics there is medicine, and they're in charge of giving it to the athletes. They give treatment, like I mentioned before. This treatment can vary from ultrasound, Graston, uh, deep tissue massage, among other things. The work setting. Athletic trainers can work either in clinics or in the athletic trainer clinic or outdoors. When they are in the clinic, they usually are in charge of taping the athletes before they go out to practice or games. They give treatments, like I mentioned before. They handle paperwork. They meet up with coaches to talk about each athlete. And when they are outdoor, they are in practices, games, rehab, because some rehabs they do it outdoor. If they're, let's say, if they're rehabbing a kicker, sometimes the rehab that they do, they have to go outside to be able for the athlete to be able to kick the ball and see their progression. Education and certification. To be able to go into a program for athletic trainer, a master's program, you have to have a bachelor degree. This bachelor degree can be in anything related to health sciences or kinesiology, physical education, or as long as you have the prerequisite, you are also good. There's people that have done business and do their prereqs and get into like the program. And then after that, you have 2 years of certified master's program. After you graduate, You have a 3-part examination by NATA, which is the National Athletic Training Association. And usually after that, you do an internship, you start working, you build yourself up. Every 3 years, you're required to get recertified for CPR and also have 75 hours of continuing education. And on top of that, you have to get certified every year for the bloodborne pathogens. For my personal timeline, my milestones, the project started when I started the project. And then I'm planning to take the GRE on January and start applying to graduate schools. The first deadline for the school that I'm applying is February 15, and it's USF. And then from there, it starts going to March and June. This is my final spring semester, the 2019, so it's going to go from January to May. Hopefully, I graduate with my bachelor degree in May. After that, I'll complete the 2 years of master's degree, depending on where I get in, and I should be graduating by 2021. After that graduation, I take the board certification exam. That should be right after graduation. And after that, I'll just work in a sports facility with athletes. Maybe start off in a university and work my way up to a professional sporting team. Thank you for listening to me. Have a great day.